Do I look like an idiot?
No. Why don't you show me how your inhaler works?
So we're here today to talk to you folks about albuterol and pine bark extract. They're the two drugs that we're going to be chatting about. Sweet, I just remember that. We have a scenario of an 8-year-old boy and his mother visit the primary care provider for a refill on his albuterol inhaler. He's also on an inhaled glucocorticoid. The mother states she would also like to begin giving her son pine bark extract, as her friend from Taco Time told her it would help her son's asthma. Well, will the nurse perform? So just a little bit of background. Oh, a bit of background. Dang, information about albuterol and pine bark extract. Albuterol, as we know, is albuterol is a bronchodilator. It works by activating beta-2 receptors. One of the trade names, including albuterol, is going to be Ventolin, and then it's really usually indicated for acute asthma, but also control of COPD. Pine bark extracts, to use a bunch of information. The primary ingredient in that, the actual active ingredient, is a thing called proanthocyanidins, and it's basically just, it comes from these kind of like French sea trees. They're like trees on the coast of France. And it's kind of pine bark that was used in sort of like old wives' remedies and stuff like that. It's like a tea that they kind of make like that. And it's used for a whole lot of different things. One of the things it really does, they don't know how, but what it does is it increases the immune response. So they're still kind of figuring out. It's something that you can find in a lot of different sort of like herbal remedies, but it's not really particularly well studied. So that's something to keep in mind. Anyway, we're going to go ahead and there it is. We're going to kind of chat with our patient. So, cool. Hi, Rana. My name is Evan. I'm one of your nurses here, Jacqueline, as well.
Hi. So I wasn't here last time when my son, his dad brought him here. So can you explain a little bit to me more about what the albuterol is and how it works? All that stuff?
Yeah, absolutely. So albuterol is what we call a bronchodilator. It basically works by activating receptors in the cells of your son's lungs. And those are going to allow it to sort of increase the surface area that air has to travel through. Because with your son's asthma, the bronchioles, the tubes in his lungs, can become constricted, become too tight. There's not enough room for the air to go through to actually get to the spaces where the CO2 is going to be traded out for oxygen. So the inhaler is going to work by allowing your son to kind of open up those airways and get a little bit more space for the air to move through.
Okay. Now what about this pine bark extract? My friend was telling me about it. You can give it to kids with asthma. It helps them.
Pine bark extract is kind of an herbal remedy that is used for a whole lot of things, not even just asthma. It has been seen to be pretty effective with asthma.
doctor if, you know, the inhaler's not working or if it's causing, you know, the chest pain isn't going away, palpitations, dizziness, rapid shortness of breath. And another thing with the albuterol is that you, for your child, you want to reduce or eliminate caffeine products entirely because they will increase the stimulant effects, so stuff like Coke and chocolate. Or in the case of your child, you really want to reduce that. So does that make sense? Are you able to tell me a couple of those side effects? Or?
Side effects, so anxiousness, tremors, chest pain, palpitations, and then with him, definitely insomnia and activity.
Yeah, you definitely want to come in to report that.
Yeah.
That becomes severe.
Yeah, so far he's been dead. Okay.
You mentioned that your husband came last time, or the son's father came last time to kind of learn how to use the inhaler. Do you feel comfortable in teaching your son how to use this inhaler? Would you like us to educate you a little bit on how to do it?
If we could just review it.
Yeah.
He uses it on his own, so.
Okay,
I
great.
just know how to do it.
Yeah, pretty much, we're going to use the inhaler for kind of rescue situations, so when he does start having that acute effects of his asthma. One thing that we're going to provide you just in case you don't have one is a spacer, because we find when children use a spacer, they have a better access to the medication, kind of gives them more chance to use it. So pretty much what we do is you'll hook on the spacer to the end of the inhaler, and then you'll have kind of sprayed in there, and then after it sprays, you have to take a big deep breath in. We want to make sure all the kind of medication that's put into that little spacer is going to get into his lungs. So I'm going to breathe in